Hey everybody, it's Dr. Jackson from the Sports Pod, and today I want to talk a little bit about bursitis, in particular, bursa, what is it? Quite a few of you out there have been asking me, what is bursitis? How do I know if I have bursitis? And so I'm going to try to clear up some of those, questions real quickly here, and I'm going to basically focus on the bursa in the knee, just because I've been doing a lot of videos about knee injuries, and different biomechanical, alignment issues, with the knee. So I'm going to kind of stay on that track here, but there's bursa throughout the entire body. There's bursa in your shoulder, there's bursa in your knee, there's, bursa, in your feet. But like I said, we're actually going to talk a little bit more about the knee. So, your knee actually has 14 different bursa. So, that seems like a lot, and most of you probably would never even guess that, but 14 actually. So it just goes to show you like how important the knee is and how intricate the knee is. And so this just should help shed some light on why it might take so long for you to recover from a knee injury or some sort of chronic nagging knee issue, just because it's so complex and there's so many structures in there. So what is a bursa? So a bursa is pretty much a fluid-filled sac that actually helps facilitate, normal range of motion and decrease friction from different structures throughout the body. So generally speaking, you're going to have maybe some tendons or ligaments or muscles, a bursa, and then like a bony structure, for instance, like maybe your femur or your tibia in your knee. So the bursa actually helps to basically dissipate friction and allows things to glide smoothly over one another. Also helps absorb a little bit of shock there and create, kind of some space between all of the structures so that we can, move properly and all the little structures can function like they need to function. So, how do you get, a bursitis, and what is a bursitis? Well, itis pretty much just means inflammation. So it's a pretty safe bet to say that if you're diagnosed with some sort of itis, you've got inflammation pretty much in that region that you're complaining of having pain. So for instance, in the knee, maybe you'll have, bursitis, in the front of your knee, because there's actually a bursa in between the knee cap and then the skin. You've also got, bursa on the inside aspect of your knee, between what we call your pes anserine, which is a common attachment point for some of your adductors and other muscle groups on the inside of your knee. You've also got bursa at the back of your knee, and that sometimes, if it gets inflamed or swollen or is painful, it might be considered a Baker's cyst. And so I'll kind of talk about that in another video. But generally speaking, it's going to get inflamed. Maybe it's infected. Maybe you got some sort of infection. A lot of times it's from trauma, so maybe you landed, straight on top of your knee, and then that gets really irritated, and you get inflammation, in the area or of the bursa itself, and that causes, a bursitis. Oftentimes it can be caused by compression, so maybe you're, the bursa or the joint is just compressed too much, and you've got a lot of like repetitive, movement, and that irritates the bursa. So pretty much for the most part, if you, kind of give it a little bit of a rest, take some tension out of the muscles that are kind of surrounding the bursa, that's a good way to alleviate some of your pain. And then, just kind of working your way back into things. I mean, a lot of times, athletes come to me and they're like, gosh, my knee's killing me. It feels kind of like hot. It feels kind of swollen a little bit. It's irritated if I touch it. And they might think that they've got a bursitis, but then again, they just said, hey, look, I have been out of the game for like a few months and I just went and ran 5 miles. Well, you kind of have to work your way into that. So one way to kind of help avoid getting some sort of inflammation of the bursa is just to pretty much like ramp yourself up into what you want to do. And that'll help kind of strengthen the tissues and build capacity in those tissues in a manner that's going to be more consistent with what you want to do and keep you from getting a bursitis. So that's pretty much it, guys. I'll do some more videos on some specific bursitis conditions of the knee. Hope you learned something here. If you have any questions, feel free to contact me. Hit me up on social media down here in my left-hand corner. Once again, my name is Dr. Jackson from the Sports Pod, and move free.